Hello friends, welcome back to Dr. Jaggi's Academy. In continuation with the chapters related to pathophysiology, last time I discussed the pathophysiology of syphilis, that is one of the STD. So now I will discuss two more STDs in today's lecture, that is gonorrhea and chlamydia infection. So let's start. So as I told, in this video I will discuss about the gonorrhea and second chlamydia infection. So now starts with the gonorrhea. Gonorrhea is a bacterial infection. It is caused by a bacteria called as Neisseria gonorrhoeae, which is actually a gram-negative in nature. Gram-negative, it is a type, gram is a type of a stain. So there is a specific method. Then we say it is a gram-positive or gram-negative. So it is a gram-negative bacteria. And coming down to the shape, it is diplococcus. That means two coccus spherical bacteria, they are joined with one another like this one. So this is the coccus and two they are joined. So this is diplococcus in nature. This is the causative microorganism. And important thing is that human is the only host for the diplococcus. That means this bacteria can reside only in the humans. And humans can transfer the pathogen from one human to the another human. So about the infection. So this bacteria causes the infection in the lower genitourinary tract. That means involving the genital region and involving the urinary system. And you can say it is one of the most common infections in this region, in this anatomical region I am saying. So when this microorganism enters, it has a short incubation period. Incubation period means the time period between the entry of the microorganism and appearance of the symptom. So that incubation period is just 1 to 10 days. Compare this incubation period with the syphilis when it was 90 days, that is 3 months. So now, what kind of symptoms will be there if this infection occurs in the males? I will discuss first in the males, then I will discuss in the females. So now, the most common region that is infected in the males is the urethra. And urethra is related to the urine micturition. So the symptoms are ultimately related to the urination. So what kind of symptoms? Dysuria. Dysuria means pain during the micturition, one of the very important symptoms. Then the frequency of urination will increase, another important thing. Third, it will not be just the urine. In the urine you will see some extra discharge, some extra thing that is actually a discharge, that is mucopurulent discharge. That discharge is actually made up of two things. One is the muco mean mixed, mucus, purulent mean pus. So in the urine, a mixture of mucus and the pus can be seen. So these are the typical features of gonorrhea in males. So now more features in the males. I told urethra is the major organ, but not the only organ. Some other organs can be there, like rectum, like the oropharynx. Oro means obviously the mouth and the pharynx. And then the eyes. How the infection reaches actually to the eyes and to the pharynx from the genital region? It is actually because of the auto-inoculation. Auto-inoculation means auto means itself, inoculation means by passing. That means the patient's finger transfer the bacteria from one region to the another region. So the patient's fingers may spread the infection from one region to another region. So this is the auto-inoculation. That is how the infection may reach to the eye, oropharynx, or to the rectum from the urethral region, from that genital region. So now, coming down to the complications, that means if the infection is not controlled, how it can damage, long-term damage in the males. But in males, the complications are relatively rare, not that frequent. But if they happen, then it may involve the inflammation of epididymis, that is called as epididymitis. Then inflammation of the prostate gland, prostatitis. Then inguinal lymphadenopathy, that is lymph nodes may be swollen in the groin region, in the genital region. So this is the lymphadenopathy. Then urethral structure, that means in the urethra, the urethra may narrow down actually, that is called a structure, narrowing of in the tube of the urethra. So ultimately it will impair the urination. So these are the complications that can happen, but remember these complications are rare in nature in case of males. Now coming down to the clinical presentation in the females. So now, in comparison to the urethra, in females, this is the region which is most commonly affected, that is endocervical canal. So what are the symptoms? Symptoms are relatively similar that happened in the males. Dysuria, that is pain in the urination, during urination, increased urinary frequency. Then abnormal vaginal discharge, and sometimes there may be bleeding from the uterus. And again, there is a discharge that I told, discharge. This discharge contains the pus, purulent urethral discharge. So now, as in males, the other organs may also be affected in the females. Same, urethra, rectum. Urethra is the most common site in the males, but it is secondary in the females. Rectum, oropharynx and eyes, same. Now the infection can spread by autoinoculation, that is through the fingers. Coming down to the complications in the females. Now the complications were rare in males but not in females. Complications are more common. So what kind of inflammation, what kind of complications? One of the complications is the pelvic inflammatory disease. In the short we use PID. And if this pelvic inflammatory disease means there is a generalized inflammation in the pelvic region, and there are various consequences if this kind of inflammation take place. One of the consequences will be the ectopic pregnancy. What is ectopic pregnancy? Ectopic pregnancy means normally actually fetus attached to the uterus region, but if this fetus doesn't attach to the uterus but attaches to fallopian tube, or sometimes it retains in the ovaries itself, then that is called as ectopic pregnancy, and that is very dangerous because ultimately the fetus will be dislodged. Pregnancy will not last for a longer period of time. So this is ectopic pregnancy. So what I have written is the attachment of fetus to the site other than the uterus. Second, it may also be a reason infertility can take place because of this PID. Second thing, another complication, it is called as disseminated gonococcal infection. In short, we use word DIG. Disseminated means the infection which was there in the genital region, in the endocervical region, it was localized to one region. Now it spreads to widespread organs. It spreads to almost all the organs in the body. Dissemination of the disease, dissemination of the gonococcal. So widespread distribution of microorganisms to different parts of the body. So these are the two common complications of gonorrhea in females. So how to diagnose gonorrhea? One obviously is the clinical symptoms that I told in males and females: dysuria, abnormal discharge, these kind of things. Now to confirm those things, we can go for the staining. As I told, the bacteria is a gram negative, so we use the gram staining. This is one method, and see under the microscope the shape, etc. Second is the culture method. Culture method is the most reliable method. What we do, we take out the smear, okay, then that smear is cultured in the laboratory for 24 to 48 hours. Once that is cultured, the microorganisms grow in the petri plates or the dishes. Then you carry out some biochemical test like oxidase test or the carbohydrate utilization assays. So these tests will confirm whether it is the gonorrhea or not. There are some new molecular methods also, like the use of the ELISA, DNA probes, PCR, that is polymerase chain reaction, or the ligase chain reaction, which are based on the principle that they identify the presence of DNA of the microorganism. So this is what I wanted to discuss with you about the gonorrhea. Now I will discuss the second infection, second STD in today's lecture, that is chlamydia infection. Now chlamydia infection is caused by a microorganism called as Chlamydia trachomatis. So this is obligate. Obligate means it cannot live without. So necessary, essential. So that is a meaning of word obligate. Intracellular, that means inside the cell. Parasite, so that means it has to reside inside the cell in the form of a parasite, otherwise it cannot survive. So this is the intracellular parasite, and this shares the property of viruses and bacteria. So it has both the properties, like I will discuss. If you discuss about the viruses, what is the property of viruses? You know, viruses are parasites. So similarly, chlamydia also needs some living cell for the survival and replication. If this living cell is not available, it cannot survive. That is why it is called as obligate. But with what is the feature of the bacteria? Bacteria, that means these chlamydia have particular cellular identity like the bacteria, but viruses do not have particular cellular identity. If they are not present in a living cell, they are not having any identity. So this is the thing of the bacteria. These are capable of maintaining their cellular identity. This is the feature of the bacteria, and viruses of the feature. The feature of the virus is that they are parasites. So now coming down to the symptoms of chlamydia in the males. Again, there are very common symptoms of the gonorrhea and the chlamydia. Like one common symptom, that is urethra is the most common infected site in the males. So symptoms you can guess. They say dysuria. There is a mucoid discharge, again abnormal discharge. But what is the difference? The difference is that it is mucoid. And if you remember in the gonorrhea, it was mucopurulent, more of the pus. But here there is a more of a mucus. So urethral discharge is less profuse. Less profuse means less volume, less in quantity. Less profuse and more mucoid, more watery, less pus as compared to gonorrhea. Other sites can be affected like rectum, oropharynx and gyne. So you can see there is a lot of similarity between the symptoms, but there is a difference also. Now coming down to the clinical symptoms in the females. Again, you can see the similarity. Endocervical canal is the most commonly infected site. And you can say that person will not come to know that she is suffering from this chlamydia infection till it reaches to the endocervical canal. So that means it is not easy to identify before the symptoms come. So what are the symptoms? So there is a mucopurulent discharge and more of a mucus, less of the purulent, as I told in males also. So again, complications similar to like in the gonorrhea, PID, but this is more common in comparison to gonorrhea. So if you compare chlamydia and gonorrhea, the chances of PID are higher in chlamydia in comparison to gonorrhea. So this is what I wanted to discuss in today's video about the gonorrhea and the chlamydia. In the upcoming video, I will discuss about the genital herpes simplex, chancroid and trichomoniasis. Thank you.